Hello, I'm Dr. Huffman from Florida Injury Medical Centers. If you've been involved in an auto accident in the Coral Springs area, give me a call. The call is free, the consultation is free. 866-402-4250. I'm an osteopathic physician, board certified in family medicine, but I've spent over 3 decades treating soft tissue injuries. I know how to diagnose whiplash, other soft tissue injuries. I know how to treat those injuries. I know what sort of imaging you need. I know what kind of referrals you need. I make sure you get imaging done quickly and you get consults to the neurosurgeons, orthopedics quickly. I've been doing this for over 30 years. So I know how to diagnose, treat, and defend my cases. I defend my cases in court. So if your insurance company is refusing to pay your bills, I'll go to court with you. I'll defend those diagnosis, treatment plans. I'll defend my impressions of your diagnosis, your treatment, why you needed treatment, what got better, what didn't, what may be permanent or need future care. If you're working with an attorney, they love to work with me. Again, I've been doing this for 30 years. I've been in court more than some of the attorneys. I've been doing depositions and court appearances and defending my cases for 30 years. They know that without a good documentation on the front end of the case falls apart. You may get stuck with bills or not access the medical care you need. That's why you have an attorney, to make sure you get what you need. So I'll work closely with them. As a primary care physician, I work closely with your primary care physician. They need to know, even though they won't diagnose or treat auto injuries, they want to know if their patients are doing well, what's going on with them. I send a report out to them immediately after I see you. I send reports to the insurance company, your attorney. So this is all done from the comfort and privacy of your own home. If you do utilize my service, after we do this free consultation, you say to yourself, you know, this guy sounds like he knows what he's doing, seems like a fair and reasonable man, I'll give him an opportunity to represent me or help me through this case. I will then send you a text link to your cell phone. So you never leave your home. You simply go home. I send you a text link to your cell phone. You tap the link, you see me, I diagnose your injuries. I diagnose your injuries, I send medications in your local pharmacy, I send out reports to primary care physician attorneys, and the insurance company pays for that bill. That's the 21st century way of reporting your injuries. The horse and buggy way is to go to the ER, sit there among sick people for hours, be exposed to excessive CAT scans you didn't need to begin with, have a $5,000 lien placed on your insurance, and then discharge with the medications that I could have sent home to your home anyways. Don't go to the ER, don't go to the urgent care unless you absolutely have to. If you have head trauma, chest or abdominal trauma, if you've got neck or back pain, believe me, they are going to waste your time and money. In 2021, I saw hundreds of CAT scans. I saw 2 abnormal CAT scans out of hundreds. And they were patients that had significant head trauma at the injury. They couldn't get out of the car themselves. So if you've been involved in the Coral Springs area in a car accident, give me a call. I work with your local chiropractic physicians, physical therapists, orthopedic, neurology, your local attorneys, your local primary care physician. All the hands-on stuff is done locally within blocks of your home. What I am is the primary care physician of your injury case. I'm pulling in the chiropractic notes, physical therapist notes, orthopedic notes, ordering imaging, ordering consults, so that when your insurance company wants to know what's going on, your primary care physician or attorney, they come to me. Say, Dr. Huffman, what's the status of this patient? Here it is, clearly the diagnosis, the treatment plans, what we've ordered, where we sent this patient to. Another very important key is that I'm working for you. I don't have a brick and mortar clinic where I want you to come in and spend all your PIP money and deplete that and then order what you need. If I'm on the front end, I'm going to order what you need regardless. You need imaging, you're going to get it, and you're going to get it early. If you need consults, you're going to get those and get those early. It's important to you. So sure, we want some conservative care, but we don't want to avoid other necessary imaging consults in lieu of conservative care for 6 months. So you're going to get early and adequate diagnosis, consults, and imaging when you use me. If you're at fault, you also need to call me. Many at fault people feel that their insurance rate is going to go up if they report their injuries. Well, if you've been in an auto accident, they're going to go up. If you're not in an auto accident, every year they go up. Your insurer may drop you after an auto accident. Now you spend thousands of dollars. You've invested that money so that if you got injured, you could pull that money back. That's what insurance is for, to pay for your injuries. If you deny yourself that access to that funds, the insurance company is going to love you. Here's a person who gives all this money and told us they don't want any of it back. I'm not saying that you need to go on to get a bunch of care if you don't need it. What I'm saying is no matter how minor your injuries, report the injuries. If after a week or 2 or 3 you're saying, hey, I'm feeling pretty good, doc, I don't think I need any care, we'll just close the case. No harm done. However, if a few weeks later the pain gets worse, symptoms progress, and you need care, now you have access to the care. So if you're at fault, at least allow me to help document your injury, no matter how minor. We don't have to do anything, but let's get it reported so that you have access to it. If you've been in the Coral Springs area and you're in accident and you're in care right now and you're not happy, give me a call. 866-402-4250. The consultation, second opinion, is free. If you're not happy, we'll get you into some place that provides better service. It's your money. You're paying that center for that care. Call me. I'll move you into a center that provides better care. Often patients say, well, my attorney sent me there, I have to go there. That's not true. Your attorney is interested in your well-being. Your attorney wants you to get better, and if you're not getting better, not getting the answers, providing that, transferring you into another clinic that can do that will only make your attorney happy. Particularly if I'm involved in the case where now they have a physician, a medical doctor, who's co-managing the case, who's issuing to them medical reports, collaborating with the orthopedic and neurology specialist, filing your claims for your insurers, for your employer, for your primary care doc. They like to have a person like me managing those cases. So your attorney wants you to get better. That's the final line. The bottom line. They want you to get better. And if that means coming out of one clinic and going into another, they're fine with that. So whether you've been in an accident and you're in care now, or it's a recent accident, or if you have a family or friend that's been in an accident and they need care, if you're at fault or not at fault, give me a call. The call is free. The consultation's free. 866-402-4250. That's my personal cell phone. You're not going to be talking to a marketing person or a nurse or an assistant. If I don't answer immediately, I'm with the patient, I'll answer you within 24 hours. I promise you that. So call if you need anything, and I look forward to hearing from you. Thanks.